realized that there's a lot of need out there. In fact, when we meet with people from the different countries, a lot of leaders, many of them express the need to maybe meet up, to share practices and so on. And even as we discussed with TF staff, we realized that they were actually quite keen to do something like that. We felt that it should be something that maybe Singapore can come together to do rather than just as a cluster, because like SingHealth cluster has got its own strength and maybe some areas that they are good at, they focus in. But there are also other clusters that maybe are different stage of development or maybe have different aims. So that's where we thought maybe the two largest clusters could come together to do something.
The National Healthcare Group and SingHealth are delighted to host the inaugural Temasek Foundation Healthcare Executives in Asia Leadership Program. We are happy to have our friends from all across Asia join us in these few days of learning. And through this learning, we hope to build a strong network so that we can co-learn with our counterparts in healthcare across Asia.
Today's rather special. It's all about going very deep and learning about the hearts and bones and vessels and the muscles of just one hospital in particular, that's Temasek, which is where we are now.
Populations can face trauma in several areas. There can be man-made trauma, of course, when we are faced with wars and terrorist attacks. But we also face natural disasters which cause trauma to large populations.
The keyword I used was sustainability. A lot of people feel that sustainability is not a global aim, good enough aim, but actually it is. Why? Because there is no sustainable healthcare system in the world today.
You have told us, shared with us in a very transparent manner. You have also taken us to some of these places like the diabetic center. So you have not talked, you have walked and talked to us.
In India, we are trying to improve our healthcare delivery system, try to make it more efficient, affordable and accessible. Singapore has done a lot of things which you can learn from, and this program is basically throwing lights on these areas.
We just visit the hospital, really systematically from the outpatient, inpatient and everything. It's very good. Especially I think that is because of all the system support by the hospital.
Kind of experience sharing that we can strengthen and potentialize our need, because we all together we work for the patient.
The document, they are beautifully prepared for us. The arrangement, logistic, everything was so good.
Many of us who are clinicians come to be clinician leaders, right? And administration can be something quite new. So this is a very good platform to know the different parts of administrative skills, which are perhaps not something the clinicians know very much about.
So everywhere when we develop quality system, make sure that the quality system doesn't over-govern, doesn't under-govern.
The TFA program had brought a lot of networking among the Asian leaders in health.
The leadership education, the leadership sharing and networking is so critical. People who are running the healthcare, they're actually very lonely, all right? And they actually like to know people who are in the same journey.
I think it's very inspiring for us to be here, and many things can be implemented in our hospital.
It's a very good opportunity for us, those who are working in the health sector, who are policy maker and also health professional in Asia.
Definitely your experience is going to help us a lot for developing our country's systems.
The program was a great initiative, and I was genuinely
surprised and thankful for the invitation.
The TF Heal program has been an amazing experience for me. I have been impressed by the speakers as well as my colleagues who have attended the program, and it was a give and take of information back and forth, and I learned so much, and I can't wait to go back to my organization and implement a lot of the things that I learned.
So by coming together within this group, I think there's a great opportunity for very deep sharing, and we can all learn from each other to meet the common goal of improving the quality of healthcare within the region.